Hello, everyone. I picked healthcare for my career research project, and my name is Zach Simcone, and I'm just going to tell you a little bit about why I picked it and everything that goes into it. So let's get started. Healthcare. I chose healthcare because I've seen firsthand what healthcare workers go through every single day. My stepmom is a nurse, and I saw the everyday grind that it is. And once COVID-19 hit, it got so much worse for her, and it was just so tough on her, and it was so tough on her family, and all of our lives changed because she was going into the hospital every day, and my family and I had to pretty much quarantine, stay away from people just in case she were to catch anything, and it was just a really nerve-wracking. So yeah, nurses and doctors are very important to the health of people, obviously. There's so many different positions like nurse practitioner, nurse's assistant, nurse anesthesist, and a registered nurse. Another big career within healthcare is a physical therapist. Physical therapists are important to make sure that when a patient has any type of injury, that they get back to where they need to, that where they were before their injury. Dental hygienists are also a major part. Uh, Everybody needs to have healthy teeth. Nobody wants to get teeth pulled or anything because they don't have healthy teeth. So, all these careers are really vital to everyone, and it's very important that everyone has people to take care of them. The history of healthcare. Medicine and healthcare started in the 1700s, but there were very little medicines and healthcare workers who knew what they were doing. In the 1800s, a lot of soldiers passed away due to disease because there was no treatment for them to be cured. After the war ended in 1886, the United States Army established the hospital corps. This was a way for soldiers to get any kind of treatment that they had been missing in the past. In the 1900s, organized healthcare started to develop. Health insurance became a very important thing to acquire as this was a way to pay for the expenses of healthcare because healthcare is very expensive. In the 2000s, coverage of health insurance spread to millions of Americans. The Affordable Care Act in 2008 gave every single American a good chance to gain health insurance to stay healthy and afford it. Once President Trump became the president, he looked for any way to stop the act, causing millions of Americans to lose their coverage. Healthcare job description. Nurses are a key part to the healthcare system. They have many important roles. Nurses have the responsibilities to monitor patients' behavior and write detailed reports on exactly how the patients are acting. Other responsibilities for a nurse would be to clean up patients if they need it. They just overall take care of the patients in the hospital. Personally, I do not think I would really like anything about nursing. I have a very sensitive stomach, and if I see anything I do not like, it might not end well for me or the patient. A normal work setting would be in a hospital working on the floor, just monitoring patients, making sure everything's all good. Depending on the type of nurse, it may be different. But the typical RN will be working, just making sure everything is all good. Some nurses may be in surgeries, helping by handing tools to the surgeon that they may need. The average nurse makes about $73,000 a year, with more experienced nurses making more, and young new nurses making less. There are many benefits like very good health care and high salary. More benefits would be job security and incentive to perform their jobs to the best of their abilities. Personal characteristics. To perform the jobs to the best of their abilities, a very good education would be the first key to being as successful as possible in this career. Good training would be another one. In-person training is probably the best way to get experience in the job you are in before you are by yourself. In almost anything anybody ever does, practice is so important. The more practice, the better. In this case, the more times you practice giving someone their medicine, the easier it'll be when you are by yourself and must give an actual patient their medicine. I personally can never be a nurse or in the hospital of any type. Even just watching a show like Grey's Anatomy is a little much for me. So just based off that, I do not believe this would be a career I would want to be a part of. With that, I am very thankful for the people that do this, and I love helping others as best I can, so I think that would be a good thing for me. like I've been saying, it's just tough for me to handle people like this. And my career path is I plan on being a teacher, so helping others will be a huge part of my job. Qualifications. The most common degree to become a nurse is a BSN, Bachelor of Science in Nursing. This education will give you the opportunity to become a nurse at a very common level. You can advance in your studies and get a Master of Science in Nursing. The higher the education, the more money that will be on the table. That pretty much goes for any types of jobs. Some potential areas of study would be nursing, dentistry, and physical education. These are just some of the different paths to get on a career track of healthcare. Social work in healthcare. So, social workers, I feel, are pretty important in the healthcare world because you could be having just a really bad experience with healthcare, and your family could be struggling, and social workers are just there to be able to talk and work you through it and try to find solutions. And I just feel like social workers in healthcare are very important because of, I mean, if something's very bad, it's really unfortunate for the family and it could get really bad. So I think like social workers are very important. Summary, healthcare workers are just a major key to people staying healthy. Um, like I said in the beginning, I have a completely different level of respect for all healthcare workers once COVID-19 hit. Like I said, I saw it firsthand with my stepmom. People were working for more than 24 hours straight to try and take care of all the patients, and they're putting their lives on the lines every day going into work. And at this point, nobody really knew what COVID could really do to you. And um, and there's just so many different types of healthcare workers, and they all play different roles. And I mean, almost everybody, if not everybody in this, at least in this country, has seen a healthcare professional before, and they've helped them out, got them medicine, got them treatment, got them surgeries, got them anything they may have needed. And the other thing that might go unmentioned about healthcare workers is how they work. There's no days off. Like, personally, I've seen it. My stepmom has missed Thanksgivings with the family and Christmases, and I know that hundreds of thousands, maybe even millions of other healthcare workers are doing the same thing on Thanksgiving and Christmases to be able to take care of patients when they need it the most. So there's just another example of how they sacrifice their lives to keep us safe. And healthcare workers are some of the best people out there, and they're some of the bravest people out there as well. And I don't think we'd be who we are without them.